Good afternoon, good evening. So we are discussing about the shock, and we already covered the hypovolemic shock in the earlier video in detail and what kind of treatment you have to give. Now we are going to discuss other types of shock. Cardiogenic shock, I already told. Cardiogenic shock means if your cardiac pump is not working properly. So in that case you are unable to maintain the blood pressures. So that could result in the shock, that is the cardiogenic, means there is a problem in the pump. Then there is a distributive shock. In distributive shock, I told you there is a abnormal increase in the capacity of your cardiovascular system. So I told you there are two things. One is, again I am telling, one is your volume. Volume is your 5 liter, and capacity of your cardiovascular system. Capacity is also 5 liters. So due to X, Y, Z reasons, when your capacity is increased much more. So if capacity is increased much more, then what will happen? Your venous return will not maintain, your cardiac output will not maintain, and patients can result in the shock. And in distributive shock, there is a septic shock, anaphylactic shock, and neurogenic shock, right? So one by one we are going to discuss, and there is a difference between septic and anaphylactic shock. So first we can discuss about anaphylactic shock. Anaphylactic shock. Anaphylactic shock, what happens in anaphylactic shock? Particularly if you are exposed, for example, 20 students went to the garden, right, and you are exposed to the pollen, right? There are 20 students who went to the garden, and in garden they all are exposed to pollen, right? They are exposed to pollen, right? So what happens when you are exposed to a pollen? Pollen is considered as a exogenous substance. So your immune system will destroy it. Immune system will sense it, it's exogenous, and your innate immune systems, your WBCs, will destroy it, right? Because pollen is a exogenous substance. So what happens? 20 students, for example, went to the garden, they are exposed to, all are exposed to pollen, pollen sensed by their immune systems, and that WBCs has destroyed the pollen. But unfortunately, for examples, out of 20 students, 2 students are unfortunate, and in their bodies changes has been happened. And what changes has been happened in 2 students? What happens? This pollen is not destroyed by your innate immune system, that is your WBC. But this WBC, what WBC has done in these 2 students' body, these WBCs has not killed the pollen, but they have catched this pollen and present this pollen to the adaptive immune systems. And I told you in earlier video, as a adaptive immune system is your helper T cells, B cells, makes your adaptive immune system. So normally it should be destroyed by the WBC, but unfortunately in 2 students' body, what happens? This pollen is not destroyed by WBCs, and these WBC catch this antigen and present to the helper T cells. And in earlier video also I told you how this presentation mechanism. There is a MSC molecules, right? Major histocompatibility complex. 2, if antigen is catched or pollen is catched by MSC2, it will be presented to helper T cell. If it's catched by MSC1, it will be presented to cytotoxic T cell. So on T cells there is a protein, that is a TCR, T cell receptors. There is CD4, and there is a co-stimulatory signals, CD28 and B7 molecules. When this presentation happens, so if you remember, I told you there is a clonal expansions, right? There is a release of lot of cytokines, and these cytokines, release the cytokines, what these does? These cytokines will going to activate your B cells, and B cell is going to convert into plasma cells. So what are plasma cells? Plasma cells are not plasma, blood plasma, no. Plasma cells are the active B cells, right? And B cell is part of your adaptive immune system. So these plasma cell will produce the antibody. So in this case, they will do the formation of IgE antibody. And this IgE antibody has a receptors on the mast cells. Mast cells are everywhere in the body, right? Mast cells. So on mast cells, there is a IgE antibodies will be attached. So this changes is going to happen to only 2 students who are unfortunate. Remaining 18 students, pollen is sensed by the WBC and it has been destroyed. But in 2 students, what happened in their bodies, these changes has been happened and their mast cell is loaded with the IgE antibody in these 2 students. Other students mast cell is normal, but in these 2 students bodies changes has been happened, and in that changes the mast cells which are present in the body of these 2 students are loaded with the IgE antibody. And how it's done? As I explained, 2 students WBC has presented this antigens. WBC here act as a APC, that is antigen presenting cells, present this antigen to the adaptive immune system. Adaptive immune system release lot of cytokines. Cytokines activated your B cells into the plasma cells, and plasma cells has produced the antibody, and that antibody name is IgE, and that IgE antibodies has a receptors on the mast cells. So now in these 2 students bodies, mast cells are overloaded with IgE antibodies. So till now they will not get any reactions, they will not get any shock, nothing will happen. They visited, 20 students visited the garden, they went to the garden and returned back to the say college, right? So they return back to college, nothing is happened to anyone. But in the bodies of 2 students, these changes has been happened. So next time when they will going to expose to the same pollen, or they went to the same garden, or they went to the they are going to expose to the same pollen, so what will happen? That could result in anaphylactic shock in their body. So how it's going to happen? Because in their bodies anti-pollen, this is the anti-pollen IgE antibody is already there. So whenever they will expose to the pollen, these pollen will directly attach to the IgE, and this mast cell which is everywhere in your skin, there is a mast cells in blood vessels, these mast cell is going to release lot of cytokines, right? But in normal body it's not going to happen. So what will happen? This is for example your mast cells. So these are the 2 persons mast cells which is loaded with the IgE antibody, and this is the IgE anti-pollen antibodies, right? So next time, for example, after 10 days you again visited the garden, or after 1 month you again visited, same 20 students again visited the same garden, and same pollen they are exposed. So now the 2 persons in which their body has been changed, they can got the anaphylactic shock. So how they will got? Because now when pollen will enter in their bodies, this pollen is going to attach directly with the IgE antibodies which are present on mast cells. When it bind with there, then what will happen? It going to result in, first is membrane damage. This membrane is going to damage these cells. Cell membrane, mast cell membrane is going to damage, and when your cell membrane is going to damage, it going to release prostaglandins, leukotrienes, all these type of chemicals, cytokines it's going to release, prostaglandin, leukotriene. Cell membrane is made up of phospholipid. Phospholipids will break down into the arachidonic acid. On arachidonic acid there is a cyclooxygenase enzymes and lipoxygenase. Cyclooxygenase enzymes will do the formation of prostaglandin. Lipoxygenase enzymes will do the productions of leukotrienes, right? This is the one. Another is this mast cells contains, these vesicles will contains one chemical, and that chemical name is histamine, and histamine will produce the allergic reactions, right? Histamine is going to produce the allergic reactions. When your pollen is bind with the IgE antibodies, mast cell nuclear machinery is also going to activate, and this nuclear machinery is going to release lot of cytokines, right? So increased cytokines, allergic reactions, prostaglandin, leukotrienes, so all will do the anaphylactic shock. So patients, if patient is asthmatic, so his asthma will become lot severe problems can happen to the asthmatic patients. This will result in bronchoconstrictions. There is a edema will form, swelling will happen. right? So all these cytokines will be released, but again it will happen in only these two persons whose bodies has been modified, whose mast cell has been loaded with the IgE antibodies against pollen, right? So now treatment, when we talk about anaphylactic shock, what treatment? Again, whatever the shock is, first you have to maintain the vital, you have to maintain the blood pressures, you have to maintain the heart rate. So all these you have to maintain, right? Another things which you can give in the anaphylactic shock is you can give the antihistaminics, right? Antihistaminic, allergic drugs, right? Anti-allergic drugs to reduce the allergic reactions, to reduce the cytokines levels. So all these drugs you can give for the management of your anaphylactic shock, right? So this is about your anaphylactic shock. Next we are going to discuss about septic shock. So there are two different terms. Anaphylactic shock is different, septic shock is different. These are not two same things. Of course, there is in septic shock also there is a release of lot of cytokines, but septic shock is different. Sepsis, we call sepsis also emergency situations, right? So in next video we are going to discuss about septic shock. Thank you.